Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. We are honored to have Dr. Krishnamani, an esteemed expert in the field of oncology. Dr. Krishnamani has more than 10 years of experience in treating different kinds of cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. Through this session with Dr. Krishnamani, he will share his valuable knowledge on knowing about kidney cancer. Without any further delay, let's welcome Dr. Krishnamani. Hello, doctor. Doctor, requesting you to give some opening insight to the session on kidney cancer, doctor.
So hello and welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. Happy Republic Day to all our viewers. Happy belated Republic Day rather. Today we are discussing on a very important topic. February happens to be the for the Kidney Cancer Awareness Month. So since February is just a few days away, we thought we'll dedicate this session on kidney cancer. So it is not a very commonly discussed cancer because it is not a so-called killer cancer if you go by the name, but it's common. We see it pretty commonly in the clinic. And there has been a lot of change in the treatment of kidney cancer, or we also call it renal cancer in medical terms. So there has been a major shift in the treatment of advanced renal cancer in the last few years. So let's discuss all that. And more importantly, from a patient point of view, there has been a shift in the way the cancer presents also in the last 2 or 3 decades. So what is the reason for why patients are presenting a particular way and what are the treatments available? Let's discuss that in the next half an hour.
Thank you, doctor. With this intro, only some spark of enthusiasm came to learn something new about kidney cancer, doctor. So without any further delay, let's start with the session. Doctor, what exactly is kidney cancer?
So kidney cancer or renal cancer or carcinoma is a tumor which starts in the kidneys. Very simple. So the commonest tumor is a carcinoma. There can be rare tumors. See, cancer can start at any organ. Understand that. So there is a tumor called lymphoma. It starts in the lymph nodes. Kidney has no lymph nodes, the kidney organ, but you can have a lymphoma in the kidney. Sarcoma starts in muscle and soft tissue. It has no muscle, but you can develop a sarcoma in the kidney. Rare tumors like carcinoids can develop in the kidney. So kidney tumor means a tumor which starts in the kidney. In that, the commonest is carcinoma or renal cell carcinoma, RCC. Very rare varieties are very rare. Let us not discuss. That's what we spoke: lymphoma, sarcoma, carcinoid, etc. So for our discussion today, we are talking about carcinoma in the kidney or RCC or renal cell carcinoma. That is what we are discussing today.
So, doctor, like renal cell carcinoma, which is the right term to pronounce if right kidney cancer?
Renal cell carcinoma.
Renal cell carcinoma.
It can start in the old or the young. It can start in men. It can be seen in men or women. It can be seen in one kidney or both kidneys. It can be seen in the upper part, middle part, or lower part. It can be seen in early stage or advanced stage. It can be seen sporadic. That is, I may be the only person who may get it, or it can be inherited. That is, in a family, many people may be involved. So one kidney or two kidneys you can have, upper, middle, or lower you can have, early stage or advanced stage, a single individual or multiple people in the family, genetic versus non-genetic, men versus women, old versus young. So this tumor can present in any of these ways.
Quite complicated cancer, doctor. Doctor, what are the causes of kidney cancer?
So one of the most important causes smoking. Okay. So as we keep emphasizing in Cancer Reach, quit smoking, quit smoking, quit smoking. Smoking is responsible for maybe more than 16 varieties of cancer, and one is kidney cancer. Another important variety causes obesity. Okay. Diabetes is linked to obesity. Maybe we see more kidney cancer in those people. Then another important cause is there is a disease called polycystic kidney disease. That is, there are cysts in the kidney. Cysts are water-filled, balloon-shaped, balloon type or water-filled structures. Your kidney will have bulges. So those patients, if they need dialysis, the risk of kidney cancer increases by more than 30%. So if you are a polycystic kidney disease patient needing dialysis, you have a high risk of kidney cancer. Hypertension has been linked to kidney cancer. Stones have been linked, but doesn't mean that every patient with renal stones will develop, but it's been linked. Lastly, inherited kidney cancers. There are some syndromes, some enzyme problems, enzyme deficiencies, we say. So in
Mhm.
families, if people have these enzyme deficiencies, they have a high risk of kidney cancer. Alcohol seems to have a protective effect, but this is no license to start drinking. So broadly, if you say smoking, inherited variety, which is seen in families due to enzyme deficiencies, polycystic kidney disease patients undergoing dialysis, hypertension, these are, and obesity are some of the most important factors for developing renal cell carcinoma.
Oh. Actually, nowadays, doctor, if you say smoking has become a trendiest thing in
I
youth,
know it
you
is
can
all,
say.
it is kind of, what do you say, projected on screen also in such a way that the hero also smokes, the villain also smokes, everybody smokes.
Exactly.
Uh,
Nowadays, it has even in the latest Mahesh Babu movie also, the smoking was a quite a trendy kind of
yeah,
a thing.
so smoking is a trendy now. I think with a lot of young people watching a lot of films now, the especially this present crop of films, be it Bollywood, South, whatever the the number of people who smoking on screen has definitely increased. What
Yes,
people should
yes.
understand is, if you smoke this way, your life also will go up in smoke.
Very true. Doctor, then what are the symptoms of kidney cancer?
This is an important point where I discussed in the beginning. So earlier, so when you open a textbook of medicine and see kidney cancer symptoms, it is called the classical triad. Triad means three, Trimurti. So the triad is pain, bleeding in urine, and a mass felt in the abdomen. So if somebody has a lump in the tummy and has pain there and he bleeds in the urine, he or she has kidney cancer. But by the time all that happens, it is advanced disease. The mass has to grow. It should be more than 4 10 centimeters in size. It should produce symptoms. Nowadays, you are seeing a shift. Why? In the olden days, 30 40 years back, so many scans were not available,
Mm.
or people were not. So imagine how big a city was, what were the amount of ultrasound or CT scan machines, hardly any, even in a city like Hyderabad. But today, for every street, you have an ultrasound machine.
Yes.
Everybody, even an ordinary person, he has pain, he'll go and he'll get an ultrasound. So what's happening because of that is we are picking up incidental tumors very early. So
Mm.
imagine I am fine now. I get a master health checkup. My office tells or my hospital says every year go get an ultrasound. Good. Last year I got it done. It is fine. Now I go and get. The radiologist will say there is a 3 centimeter tumor sitting in your kidney. It is not troubling me. I am asymptomatic, no symptoms. I am perfectly fine. I went because my hospital or my office asked me to get a scan done, or I wanted to do my master health checkup, or before applying for a visa, I am getting a scan done. Many such people are being picked up now. Routine ultrasound, routine CT, incidental scans for asymptomatic people, you are picking up a tumor. So, because you are picking up a tumor incidentally, it is in a very early stage, it's a very small size, it has not spread anywhere. So, the results are going to be good. So earlier you used to say pain, bleeding in the urine, mass and all that, and by the time you detect and all that, the patient would be very sick or the disease would have spread. Now we still see small set of patients like that, but incidental detection has increased the number of early stage cancers. This is by no means to suggest that all of us should get scanned for kidney cancer. That is called screening. We keep talking about that term. Screening is done in the ordinary population to detect disease early. Screening for kidney cancer for the ordinary population is not recommended. Screening is only recommended for high risk kidney cancer people who, suppose in my house, people have got, multiple people have got kidney cancer. In my house, many people have got, or somebody has got below the age of 40 years or a young age, or there is an inherited gene which you have identified in my relatives, then you will say, Krishnamani, see, many people in your family are affected. Some of you have got disease very early. You have a genetic problem or predisposition. So you get scanned early. Otherwise, you don't take a probe or do a CT scan, start in everybody in the population.
So even there is like a after COVID, there was a myth. Anything is there, let's go for a checkup. So I don't think so. This kind of a similar screening should
COVID
be.
also we saw that. So they were doing a
Yes.
CT for COVID for everything. When you do a CT of the chest, they will cover the abdomen also. In the abdomen, they were picking up small lumps in the kidney, tumors in the kidney.
Yes. Yes.
Yes, there's an advantage, but see, it doesn't justify the amount of scans you do. So
Yes.
maybe to pick up one scan, one tumor in the kidney, you have to do some 10,000 or 1 lakh scans. It is not justified.
Yes.
Unnecessarily, you have created anxiety in those remaining people. Unnecessarily, you have given them radiation exposure.
Hmm.
And there is no point in doing it that, and cost and the burden on the healthcare system.
Yes. Very true, doctor.
Imagine 10,000 people standing in front of your clinic for an ultrasound or a CT scan for one patient to be picked up. Is it really worth it? No. So that is the whole point.
At that time, the panic will be to the doctor. Oh my God, 10,000 people.
Yeah, I'm just this is a kind of a very
Example. Yes.
dramatic representation, but the bottom line is there is no blood test to detect kidney cancer.
Hmm.
There is no screening recommended for kidney cancer. But a lot of kidney cancers are seen early nowadays, incidentally, when they are asymptomatic due to scans being done for various reasons.
So, doctor, what are the like diagnosis for kidney cancer?
So when we were taught, or when even the classical teaching now also is, any solid tumor in the kidney in a
Hmm.
man above 50 or or an individual above 50 or 60 years is an RCC unless proven otherwise. So any solid lesion you see on the scan in the kidney in a 50 plus person should be considered as kidney cancer unless you have some major doubts. So as we do a biopsy in other tumors, we don't do a biopsy here. You will directly go and remove that. You either remove the tumor or remove the kidney. So on a scan, if you find a strong suspicion of kidney cancer or renal cell carcinoma, you need not do a biopsy. If it is limited only to the kidney. If God forbid the disease has spread to other areas, from the other area you will do a biopsy, maybe from the lung or from the liver or from the lymph node or from the fluid around the lung, which you can send it for testing and then say it looks like kidney cancer has spread there. But if there is a kidney tumor localized to kidney, not spread anywhere, you don't need a biopsy. You can directly go for a surgery if strongly you suspect that it is RCC.
Doctor, there is a query from the audience. What is the goal of each treatment? Is it eliminated? Is it to eliminate the cancer, help me feel better, or both?
What is the goal of?
What is the goal of each treatment? I guess the next question, doctor,
We
itself
will discuss
explains.
that.
Yes. So, doctor, what are the treatments for kidney cancer? I guess that will also give the answer
Correct.
to the audience.
So broadly surgery and medical therapy. Broadly surgery and medical therapy. Surgery is for localized kidney tumors. Surgery can be removal of half of the kidney or the complete kidney. If you have a small tumor located, suppose this is the kidney, and your tumor is sitting in the upper part or in the
Hmm.
lower part, you can just remove this much. You have a big tumor, or you have a tumor sitting in the middle, then you have to remove the whole kidney. So that is a surgical decision. Surgeon will decide.
Hmm.
Any surgeon will try to save your kidney as much as possible. So you can do either a partial nephrectomy or a radical complete nephrectomy based on the surgeon's choice, based on the size of the lesion, and based on where is it, upper, mid, or lower pole. Surgery can be done by two ways, or rather three ways. One, open up. This is a classical method. One, laparoscopy. Laparoscope means they put a small hole in your tummy, they put a camera, and they don't open up and cut and do all that. It's very simply done. So lesser blood loss, lesser infection, lesser hospital stay, cosmetically also better for a patient. The third method, which is of vogue now, which many people talk, is a robotic nephrectomy. You use a robot to do the remove the tumor. The point is, there is nothing called one greater than the other, or the outcome should be you should remove the tumor completely, which we say with negative margins. And if there are any lymph nodes, that also the surgeon will remove. So you are not going to use some fancy technique and leave the disease behind. That's not your job. The job is to eradicate. So that answers this person's question. You are going to remove the tumor in toto. Do it either open way or laparoscopic way or robotic way. Let the surgeon decide. So you and the surgeon sit and discuss what is best for you. Obviously, robotic is expensive. Open is cheaper. Open, you'll have a scar, more hospital stay, more blood loss. Robotic takes longer time probably to do it. I'm not a surgeon, I'm not an expert in it, but just telling you. But bottom line is the tumor should be removed. Now, suppose there is a situation. You have only one kidney. Some people survive with only one kidney. They are born with one kidney, or the other kidney is damaged, or they donate one kidney. In this remaining kidney, if they develop tumor, what to do? You cannot remove the whole kidney. So, there you cannot remove the whole kidney. Or suppose you have tumors in both kidneys, you cannot remove both kidneys. So you have to maximize renal function is the word. Maximize renal means kidney function. You have to try to keep as much kidney as you can. At the same time, try to remove as much tumor as you can. For the surgeon, it's a big headache and it's a challenge. Nice one kidney, and on one kidney you have tumor. That's not a big deal. But diseased kidney and only one kidney with the tumor, how to safely remove one tumor and also safely keep some functioning kidney is the whole goal. So this is about surgery. This is done when disease is limited to kidneys. When disease has spread beyond the kidneys to other areas, surgery is generally not advised. So in stage 4 setting, where do you do surgery? Very briefly, I have intractable pain. So bad that you have to remove the kidney. You have to do a surgery then. Hematuria, continuous bleeding in the urine. Then you have to remove the. So in stage 4 also, if you have local symptoms, you will remove the kidney. Or if you have disease spread to one or two areas only, and you are in a very good physical condition, then your doctor may say, see boss, you have disease in only few areas, hardly one or two areas. So let us do the surgery here. And then you take some other kind of treatment. Otherwise, if your disease has spread everywhere, there is no point in removing the kidney unless you have local symptoms.
Okay. So, doctor, before many of the sessions in which you have told that removal of the tumor is easy, but in kidney cancer, removal of part of a kidney is important.
No, you're removing the tumor. As we always say, when you remove the tumor, you have to take a normal area of tissue around it called margin.
Okay.
Kidney cancer, margins are not that important, people say, but if you can have a negative margin, it's the best thing to do. So remove the tumor, how much ever normal kidney around it, the margin, remove it. They will try to reach, suppose your tumor is less than 4 centimeters, you will just need a partial nephrectomy. Up to 8 or 9 centimeters or 10 centimeters also, some surgeons have the expertise to have a partial nephrectomy, uh, keep the remaining kidney. But if it is beyond 10 centimeters, it is difficult.
Oh.
So it depends on the tumor size and location and the surgeon's expertise.
Oh. Doctor, listening to it, it's giving a goosebumps to my skin, doctor. It's really a very dangerous cancer then, doctor.
It is not, so no, see, this is a medical challenge for any cancer. But the bottom line is it's a solid organ. You have another organ to pair off. You can either remove it half or remove it completely. You should just pray and hope that it should be operable. That is, it should be localized and it should not spread anywhere. That's the best thing for a patient.
Doctor, there is a query from our audience by Ramesh. Recently, my aunt diagnosed with benign type kidney cancer and kidney was removed. Is there any possibility of a cancer to other kidney?
So benign means, first of all, it is not cancer.
Ah,
So many times you can have cyst, what we told just now. Okay, so that is one. And chances of cancer coming in the other kidney can come. It's like you and me, anybody can get a cancer. But if this was kidney cancer, the risk of a second cancer is higher. Obviously, if I get a cancer, tomorrow to get another cancer, my risk is higher than the general population.
yes, very true, doctor. So better to that person can be the right term which you have told, that regular screening can save that
Correct. So
patient
benign
aunts.
means no cancer. So you
Hmm.
cannot have a benign cancer. You can have a benign tumor.
Okay.
Tumor is a growth. Benign
Hmm.
is it has not spread.
Okay. Sir, there is one more query from the audience. How serious is kidney cancer?
It is pretty serious because if you are in the localized early stage, you will do very well. But if it is in an advanced stage, survival sometimes is less than 2 years or less than a year and a half.
Oh.
So that's the whole point.
Sir, is it like nowadays the kidney transplant kind of a system that even that patient's survival will be very high, very
No, no, you are not
less?
going. You are only going to do a surgery in kidney cancer, not going to do transplant. That is not for these kind of patients. Kidney transplant is for chronic kidney disease patients who are dependent
Okay.
on dialysis. I have BP, sugar, my kidneys are gone for a toss, my creatinine is very high. Daily, every alternate day, I need to do dialysis. Then you will do transplant if I am a potential candidate, medically, if I fit the bill.
Hmm.
That is not for RCC, not for kidney cancer.
Oh, so
But,
for kidney,
hmm,
yeah, sorry, sorry.
yeah, but it is deadly if you have it in an advanced stage.
Okay. Doctor, there is one more query from the same audience. How kidney cancer is detected? Can kidney cancer spread? I guess this query has been already
Correct.
addressed.
So detected is something which I did not add. So when a tumor is detected in the kidney, you do an ultrasound first, simply, or you the CT scan it is detected. Then you may need additional scans like maybe an MRI or a PET CT or a bone scan. So these are all additional imaging tests to say
Hmm.
where all it has spread. Biopsy, as I said, is not required. But if it is stage 4, do a biopsy from whichever site. If it is a tumor localized to kidney, your surgery itself is a biopsy. That removes the tumor also and it gives you the tumor also for analysis in the lab
Analysis.
to say what kind of cancer it is, what type. In kidney cancer, RCC, the two common types are clear cell, non-clear cell. Clear cell is around 85% of the cancers, non-clear cell is 15%. Clear cell generally do well. Non-clear cell, again, there are many types. Some do well, some don't do well.
Okay.
That is the bottom line. And finally, there is a question we discussed, you had asked sometime later. We discussed the surgical part. Now, the
Hmm.
medical part comes. Kidney cancer is one disease in which we use a lot of immunotherapy and tablets called tyrosine kinase inhibitors. Chemotherapy is kind of a graveyard in kidney cancer.
Oh.
So, in one cancer where you don't use chemotherapy and we use it in a very rare subset. So, where you don't use chemo, you can actually take it as a blanket statement and do more of immuno and TKI is kidney cancer. One cancer which I told you presents across the spectrum is kidney cancer. One cancer which is inherited is kidney cancer. One cancer which is being detected at a very early stage now is kidney cancer. One cancer where surgery is the main treatment is kidney cancer. So now when you use immunotherapy, you use it in stage 4 cancers. When you use tablets, you use it in stage 4 cancers. Otherwise, after surgery, generally tablets are not used, chemotherapy is not used. In certain patients, we give immunotherapy. So immunotherapy is advised after surgery in a very select group of people, high risk patients, we say. Otherwise, immunotherapy and TKI is only for stage 4 patients. We either use only immunotherapy, or we use only TKI, or we combine both, or we give double immunotherapy. So, four types you can treat. So, you have double immunotherapy called nivolumab, ipilimumab, or you have only immunotherapy called Nivo, Pembro, etc., or you have TKI tablets, or you have Pembro plus TKI or Nivo plus TKI, like this. With all this in stage 4, what you want to do is reduce the disease, prolong the life of the patient, and improve the quality of life.
So, doctor, like even for these in stage 4, the surgery is not an option, but the
Yeah.
chemo.
Stage 4, when do you do surgery? If you have many local issues like bleeding, pain, and all that. Or you have very small disease, as I discussed. You have a kidney tumor, you have two small mets, you can remove.
Hmm.
If your
Yes.
whole body is studded, then you are going to give immuno or TKI or combination.
Listening to it itself gives doctor it's quite a challenging treatment then.
And please remember, if immunotherapy works in kidney cancer, the
Hmm.
responses are generally durable. That is, you will have long lasting responses. So the patients who do well really do well for a very long period of time. And the side effects of immunotherapy are not like chemotherapy. You don't have hair loss, vomiting, loss of
Hmm.
appetite, skin becoming dark. No, you have different side effects, which we have discussed earlier also. You may have thyroid problems after a few months. You may get some skin rashes called dermatitis. You may have changes in your liver enzyme. You may have very rarely pneumonitis in less than 5-7% people. So immunotherapy is fair, and fatigue. Immunotherapy is very well tolerated compared to chemotherapy. If you get a response, you get an excellent response. You can combine it with either immunotherapy, give it alone, or combine it with TKI. And this is the new standard of care today, anywhere in the world.
So so even the person who is getting treated with kidney cancer can lead a normal, in
Yes.
general, normal life.
They come once in 15 days or once in 21 days, take an injection shot, and they go, which is a 1-2 hour injection. That's about it.
Oh, that's good. Actually, it's a we can say that that's a blessing of a technology, doctor. Then,
Yes. So you are harnessing, that is, you are using the body's immune system to fight against this cancer.
oh, wow. Then, doctor, like, then what were like this was something on the fourth stage. Then, what are the different types of surgery available for kidney cancer?
That is what we discussed some time back. You do either do a partial nephrectomy, half is removed, or a complete radical nephrectomy. You
Hmm.
do an open surgery, or a laparoscopic surgery, or a robotic surgery.
So, total almost somewhere around 5 to 6 types,
No,
doctor.
methods of surgery are three, and when you go inside, either you remove half of the kidney or complete kidney.
Um,
That's it. How to go inside? You can either cut open, you can put a laparoscope, or you can do it with robo. Once you
robotic.
go inside, either remove half the kidney or remove total kidney.
So, like the robotic surgery nowadays, India, it is a myth, I can say, or you can only solve whether it is a myth or not. Is robotic surgery too costly, doctor? Like,
Should cost anywhere between 3 to 4 lakhs, or maybe thereabouts. Anywhere between 2.5 to 5 lakhs, depending on the center
okay,
and type of
generally,
robo.
robotic instruments, what is used?
So you have the robotic instruments also. There is a generation like Apple 10, Apple iPhone 14, iPhone 18, that kinds. So with the more advanced the robotic instrument, probably the price goes up a bit. I'm not saying it will definitely go up, but yes, it is definitely expensive compared to a conventional open surgery.
Doctor, like, can you give between little bit a brief on the role of immunotherapies? I
So,
know.
so the whole point, as we discussed, is immunotherapy used in the advanced setting, either in combination or alone. And immunotherapy has been a game changer in RCC. There was a time when we started, way back in 2010-11, when we were residents, we only had TKIs at that time, and only one TKI called sunitinib, which is a tablet, and that medicine works for close to 12-15 months. And after that, we slowly got another medicine called pazopanib, and then a medicine called axitinib. And in 2014-15, immunotherapy came into the picture. It came it came first in the diseases like skin cancer called melanoma, and then quickly into RCC.
Hmm.
After that, it has completely changed the treatment. It was initially used in patients failing TKI, second line we say. So you take tablets, and after 1.5 year, if your disease progresses, then you were given immunotherapy. Then they brought it to first line. They said, no, no, why you to wait till it progress? Initial itself give to the patient, it will give very good results. Then we said, why don't you combine with TKI? Both the medicines given initially itself, then combine immunotherapies, And now you are slowly moving. Why should this patient develop stage 4 disease only? When you remove the kidney itself, in some people who have higher chance of developing stage 4, if we give immuno, we may delay stage 4. So see how the science has done. First used in second line after failing, everything failed. Then used in first line itself. This is the best shot. Let us use it now only. Then, chalo, let us use it combination. All drugs put together will give more benefit. Then, why wait till stage 4? Go in the early setting itself.
So that can delay the stage 4. That's
Or delay stage 4 or prevent stage 4.
then it is like doctor, slowly this treatment has created a milestone and brought a best medicine to the people who
I will
are
give
with
you
kidney
just one
cancer.
example. I'm pretty sure most of my colleagues or seniors will have more examples. We had a guy, he is a young 32-year-old software professional, came to us way back in 2017. Then he was already taking sunitinib, had progressed.
Mm.
His options were to go for other TKIs like pazopanib, etc., or go for immunotherapy. So we gave him a type of immunotherapy. Ideally, they say if you do well, take it for 2 years and then see. This fellow took for 1.5 years, and he finished all his treatment by maybe 19. Today is 2024. He is doing extremely well. Mark my
Wow.
words. I have not seen him for the last 6 months. He's not come for a follow up, but I'm pretty sure he keeps messaging, he keeps saying he's good. When he came way back in 2017, he was just blessed with a baby girl who was hardly 4, 6 months old. He was worried. He had stage 4 disease. He was a radiologist's brother. Obviously, the worry was there whether I will survive, what happens to my kid. Today, the same gentleman has a house, he's bought a car, his daughter is 6, 7 years old. He has outlived his cancer. His cancer seems to be in remission, in control, and he's off therapy for 4 years and he's doing excellently well, going to work, and everything else is fine in life. I'm
Wow.
not saying this is going to happen for all the 100% kidney cancer patients we see, but if immunotherapy works, the results are long term. So we are still finding out who it is going to work, who may it not. The research is still going on, but that's the beauty.
It's like if immunotherapy works, it's like get the life back kind of a thing for a
Kind,
patient.
kind of.
So, doctor, what is the role of TKI? Just a brief, can you just have a
So TKI was first line initially. Now we use it second line if you fail immunotherapy.
ah, okay.
In certain subsets, you still use it initially. So otherwise, TKIs can have some side effects. See, the advantage is it's a tablet, take it home. The advantage in a country like India is it is inexpensive. It's not expensive. The disadvantage is it can cause mouth ulcers, it can cause diarrhea, blood pressures can go up, patients can have severe fatigue, weakness. So those are the issues.
Doctor, there is a query from the audience called Bharat. What are the possible side effects of each treatment, both in short term and long term? And he also have a continue question to that, like who will be the part of my healthcare team? What does each member do?
Yeah, surgeon, medical oncologists are all part of your healthcare team. Number one, surgeon cuts, medical oncologist will give you immunotherapy.
Hmm.
As we discussed, immunotherapy can cause weakness, can cause some fatigue, all you can have some skin problems, you can have some diarrhea sometimes, you can have thyroid issues, low thyroid, and very rarely pneumonitis. Um, TKIs, on the other hand, can lead to mouth ulcers, diarrhea, hypertension. Hypertension is a very problematic side effect. Hypothyroidism can also be there. It can cause
Hmm.
protein loss in the urine and can cause severe fatigue, burning sensation in the mouth. Compared to immunotherapy, TKI is poorly tolerated. Immunotherapy is tolerated well by patients.
Hmm.
So that is the whole thing.
Okay. So, doctor, like right now we were discussing on kidney cancer and care. What are the stages? Like, what are the stage 4 kidney cancer? How I know you have already briefed on the stage 4 treatment with immunotherapy and TKI. Just enlightening of little bit on a stage 4 kidney cancer.
So stage 4 is disease which has got beyond the kidney. It can usually go to the lungs, it can go to the bones, it can spread to other organs. And
Hmm.
once it goes there, your goal is palliation, not cure. You want to improve the quality of life, reduce the burden of the disease, improve the symptoms, and prolong the life of a patient.
Doctor, the same guy, the Bharat has a continued query with the previous question. Who will be leading my overall treatment?
Medical oncologist in general, if you have advanced disease, or you can be in the follow-up with your surgeon if you have been operated, and who will keep you under regular surveillance with scans.
And there is one more query from the same guy, Bharat. How will this treatment affect my daily life? Will I be able to work, exercise, perform my usual activities?
Yes, generally, well, everything will be on track. Exercise, obviously, we will not want anyone to lift very, very heavy weights, and all that is what I usually tell people post surgery. But otherwise, it doesn't affect your life. Control your blood pressure, control obesity, control your diabetes. Do not smoke. Those are your lifestyle modifications. Because now with one kidney less, if you have had a surgery, your risk of hypertension is going up, and you don't want your diabetes to kill your existing kidney. So more than the kidney cancer in that kidney, we are worried that that single kidney should function well.
Yes, very true, doctor. I hope Bharat has quite put many of the questions. I hope, Bharat, you have got the answers for all your query. But anyhow, doctor is always available on call. Doctor, like, what are the long-term follow-ups and survivals in kidney cancer?
Survivals are pretty good when you talk about localized cancer, but when you talk about advanced cancer, as I told you, the survivals are close to 12 to 24 months. And once you have been operated, you will be put on regular scans maybe once in 6 months or so. And for patients who are immunotherapy or TKIs also, we would probably do a scan every 4 to 6 months. If the scan is good and the patient is good, the treatment will continue. If the scan shows progression, that is, disease has increased, or the patient is not doing well due to side effects, then you have to change your treatment or reduce the dose. These are the things you have to do.
Sir, and like you have told doctor, the survival will be very challenging. It will be like 2 to 3 years, or sometimes lucky, then it will be
Less
more
than
than
2 years if
6
you are in the metastatic setting.
years. Doctor, there is a query from same by Bharat. What type of surgery will I have? Will my lymph node will be removed?
We have discussed that some time back. We have also discussed that lymph nodes will be removed if they are. The surgeon will decide whether to remove your lymph nodes. If your lymph nodes appear swollen or enlarged or appear to be involved, they will do a dissection. It's a surgeon's call. Let's not go into that.
Yes, yes,
You should,
better
as a
doctor.
patient, I would never tell my surgeon to remove this lymph node, that lymph node. He will do whatever is deemed fit. He or she will do whatever is deemed fit. And definitely, if there are enlarged lymph nodes, they will be removed.
Doctor, he has one more query. Could this treatment affect my sex life? If so, how and for how long?
Uh, Not really, because your kidney cancer surgery, I don't expect anything unless something major, some nerves have been involved or whatever. So I don't think that's to be an issue.
I hope, doctor, I will personally message him directly to contact you, doctor, because he is having many queries and
Sure,
many questions. So might be his mental hope will be relieved, doctor. So, doctor,
sure.
by this, doctor, we came to the end of the live session with your valuable insights on kidney cancer. Thank you
Thank
very
you so
much,
much.
doctor.
Thank you.
Doctor,
Pleasure.
would you like to give some closing statement to this session?
As usual, again, smoking is a very important thing. So quit smoking. Obesity, hypertension, diabetes. Obesity is linked. So this one, and it's not a very deadly cancer if we are detecting it early, and surgery is the treatment of choice. So do not neglect it if you have a tumor detected in your kidney due to some scans or whatever. And even in advanced cases, immunotherapy has become a game changer now. So don't be very pessimistic. If someone has stage 4 cancer, you have a way forward.
Hmm. Thank you, doctor. Thank you for sharing your valuable and knowledgeable insights on this kidney cancer, doctor. Thank you very much. And thank you everyone for joining this session. Obviously, all your queries in the chat box will be answered even after the session is not on live. Thank you very much. Wishing you all strength, hope, and good health.
Thank you. Take care.
Thank